Hi, I'm Dr. Meredith Jones from Kansas State University, and I wanted to give you guys an update on how the alpaca teaching herd is doing here at Kansas State University. As usual, the main focus of the herd is to provide training to senior veterinary students during their fourth-year clinical rotations. During that time, I'd take the students up to draw blood from the herd, trim feet. This group is also involved with the shearing and the basic husbandry and all the breeding practices of the herd. In addition to that, this year, just like in every farm, we've had failure passive transfer crias that have failed to thrive. Our herd sire received a leg injury, and just like on your farms, we have those same issues happen, and so our students are experiencing and working through all of those things, just as you will want them to do once they're out in practice and working at your farm. In addition to that, this year we are providing a Camelid elective, and these students have weekly labs on Friday afternoons, and we are providing them with hands-on laboratory opportunities during their second year of veterinary school with the Camelid teaching herd. And we have received very positive feedback from these students. Actually, we had started to only have 10 or 15 students in the course, and we ended up needing to allow over 50 students to take the course because of such increased interest. In addition to that, our agricultural practices section this year, we hired a new technician who needed some additional training and some Camelid techniques so that she could provide oversight for our students as well as service to our clients. And so I was able to bring down animals out of the teaching herd, teach her how to place catheters, draw blood, and do those sorts of procedures that you and your herd will need for her to be able to do when you bring cases into the clinic, and also to train our veterinary students. In addition to that, we have several research projects going on with the herd, and I know people are very interested in having research done so that we have evidence-based information about what we can do for your herds. And so the first one is that Dr. Maria Ferrer, that many of you know, who's a theriogenologist or a reproduction specialist, is ultrasounding all of our pregnant females in the herd from about 120 days gestation until about 300 days, and she's ultrasounding them every 2 weeks during that time, and taking about 10 measurements off of every cria. Head size, leg size, various measurements of the heart rate, and those kinds of things. And what she's seeking to do is to establish what normal is for how crias develop in the uterus. That information will then allow veterinarians to monitor normal and high-risk pregnancies to determine how crias are developing and if they're developing normally. In addition to that, our cardiology group is ultrasounding side by side with Dr. Ferrer, and they are taking very specific measurements of the hearts of these crias as they develop. Because of the high rate of cardiac defects in alpaca crias, we need to know what a normal developing heart looks like, what the measurements are, and see if we can determine if there are abnormalities of the heart before that cria is born. Also, one of our basic science groups is doing some DNA testing on the herd to look for a condition called chimerism. Chimerism is when two formed cells join to form one embryo, such that one animal actually has the genetic makeup of two separate stem cell lines. And so our basic sciences group is looking to see if that actually occurs in alpacas, and they've been taking some blood samples on our herd to look for that. Finally, our ophthalmology group is doing some measurements of the eyes of alpacas. And what they are looking at is a drug called proparacaine, which is a topical anesthetic which allows us to do pain-free procedures to the surface of the eye. And it is not known what the sensitivity of the surface of the eye is of alpacas. And then, of course, whether or not this actually will numb the eye. And so they've been taking corneal sensitivity measurements, or measurements of the pain tolerance of the surface of the eye, applying the anesthetic, and then seeing how long it lasts. And this will be a useful tool for veterinarians in helping with either painful eye conditions or with doing eye procedures. And so they've been working with the herd again and taking lots of measurements of eye issues. We actually did have one of our teaching herd alpacas had an eye issue this past year, and so they were able to look at that. And so I hope you can appreciate that between the reproduction group, the cardiology group, our basic sciences group, and our ophthalmology group, that we've got lots of important projects going on that will benefit your herds directly. In addition to that, many of you may have experienced the need for a blood transfusion for your animals, and you know then that the alpaca teaching herd is who provides those blood transfusions when we have alpacas come in that are anemic and in need of emergency blood transfusions. And so there is a direct benefit to you to have the alpaca teaching herd as residents at Kansas State University. Finally, one of our graphic designers at the school who is a big knitter and a big fan of alpacas, was actually asked to be featured in Simply Knitting magazine in Britain, and actually had a photo shoot with one of our alpaca teaching herd crias for that. So an interesting addition to the herd there to be featured perhaps in a knitting magazine. And so I did a little interview for them and gave them a little piece of information about the alpaca teaching herd, and they thought that was a really novel idea as well. And so we're just really pleased with the exposure that our students have to the teaching herd, as well as researchers here at the school, and every effort we are putting into improving the life and well-being of your alpacas. Thank you.